They give you the lines. It's like taking normal drip.
Oh, okay.
It's like taking normal drip. But then it goes to attack the cancer cells. But because he had to go through the bloodstreams, it affects other cells also. So you see that the tongue got dark, right? And then the fingers also got darker, loss of hair. I think she even lost the eyebrow. She lost hair everywhere there is hair. The hair was totally gone. I mean, one day I was going to, she had to take her bath. So I was doing almost everything for her. And then I put water in the hair, everything went off. I broke down, but you have to look at the person. So I just had to put myself together. She was crying. I have to, it got to a point I couldn't hold it. I broke down with her. And one very unpleasant experience in between that is when you are doing the chemo, your immune system is, it can go up to 0, even up to the negatives. So you can easily get an infection.
Yeah.
So I don't know what happened. She had an infection and she had diarrhea. She was running from 12 a.m. to 4 a.m. There was no car. All the people I was calling were not answering the calls. So I had to put her at my back. So I had to carry her at my back and walk to the main junction. Take a car, take her to Kolebo that dawn. And then she was stabilized. We came back home. But at some point, we discovered that the issue has metastasized.
It's another time on Gobe's show, on Khariz podcast, showing on Khariz TV. It's Pink October, and as we all know, it's Breast Cancer Awareness Month. So we are here to create awareness on breast cancer. With us today, Mrs. Mimi Nelly Essien. She's the founder of Gem Life Advocacy Foundation. She's also the CEO of Mimi's Walking Mall. She is the next today to tell us about breast cancer and cancer in general. And then I have Pastor Colette Sobojo of Citadel of Glory. Yeah. We are here today to talk about breast cancer and create awareness in the kingdom of Christ. So, Mrs. Essien, my first question, what is cancer and what is breast cancer? I think it's 2 in 1, so you take it from me.
Okay. Thank you, all viewers. I like to say cancer generally means the abnormal growth of cells. So linking it to breast cancer is the abnormal growth of cells in the breast tissues. Now, when the cells get into the tissues, they tend to multiply as many as they can, even more than the rate at which the normal cells that God has given us. Now, these cells, when they get to the tissues, they tend to come together, then they form something we call a tumor. These tumors get to find themselves in comfortable places where they can feed on us and cause damage to us. So basically, these are cancer. Now, these tumors, some can be invasive and non-invasive. So if I say invasive, I mean that they can go out of the breast tissue and move to your lungs, your kidneys, any other parts of the body. That is the invasive one. But with the non-invasive one, they are kept just at the breast tissue. So when they are early detected, something can be done about it and the person can be saved.
That's okay. That's so basically breast cancer is the multiplication of cells.
Yes, abnormal growth
Normal growth
of cells.
of cells
Yes,
in the
breast tissue.
tissue.
Exactly.
All right. I want to um I want you to elaborate more on the causes of breast cancer.
Okay. So globally, cancer, there's no cause. We would say it's idiopathic. But we have something we call risk factors, the things that predisposes you to have breast cancer, not just breast cancer, but even cancer as a whole. So if I'm limiting it to the breast cancer, one, the fact that you are a woman, you are at risk. For the men, you are not left out. So if we are giving the ratio, would say 99% women would have breast cancer and just 1% of men will fall in that category. So the fact that you are a woman, you are at risk. Two, once you are aging, you should know that you are at risk. But most especially in literatures, would target well from 40 years going. Yes. Then three, would say obesity. So we encourage everyone, once you go to the hospital, we do some checks called BMI, body mass index. So we'll tell you, you are growing so overweight. So check yourself so that once you don't become obese, you are not at risk. But once you are diagnosed of being obese, then it means you stand a greater chance. Then we also have those who started their menstruation very early. So as early as we have 8 years, they stand a greater risk of breast cancer. Then we would also go to our menopause people. Those who have it very late also stand a chance of getting breast cancer.
Oh, early and late.
I'm telling you. So early menstruation and late menopause. No, not menstruation. Menopause. Yes,
Okay.
for the women. So women, you could see we are really suffering. Yes,
And because the risk factors are like it puts all of us into the whole basket. We
exactly.
are all at risk,
Exactly.
no matter how old, the age. Because you mentioned from 40 going,
Yes.
it means that from 40 going, some people are less the age 40, yet they are prone to getting breast cancer.
Exactly. So that's why I said the fact that you are a woman, you will get it. But we really target from the age of 40 because that is when most people would come to the hospital complaining of lump in their breast and all that. We'll get to the signs and symptoms. So I wouldn't want to open up. So then the cardinal one is a family history of breast cancer, not just breast cancer, a family history of cancer. So with the women, when they go to the hospital and they are pregnant, they ask them, Ufie, na obi enya cancer or hoda. Then we can streamline it and even ask breast cancer obi enya bida. So if any of your family member has gotten breast cancer before, you should know that you stand at a greater risk. So let's say your great grandmother, your grandmother, your mother, then to you. So
It is supposed to know that our great grandmothers or our mother we may, but the other generation, how are we to know?
So you confined or you ask your parents, your aunties. So you should speak more. So because in this day in day out, we are the modern people and we should incite the older ones on what is currently going on. So we should ask questions. It's always good to ask questions, your background, so that it will put you in place and in check.
You know, I would like to have the period where you be able to teach us how to do the self-examination as well. But for now, what are the signs and symptoms of breast cancer?
Okay, so the signs and symptoms. So as a woman, you should know yourself. As you expose yourself in the mirror, one, you should look at your breasts. The first thing is the size. God has made it in such a beautiful way that one breast is slightly bigger than the other, and it's normal, it's fine. But when you realize that one is obviously bigger than the other, then there is a problem. For instance, you know that the left one, for you, the left one is bigger than the right one. Then all of a sudden you realize that the right one is more bigger than the other. Then it's a red flag. So one, the size. Now you check the color. Every woman knows how the color is. So if you realize that there's any changes, you should know and report to your healthcare provider. 3, we always advise that when you're about to have your menstruation, 5 days to your menstruation, you palpate your breast.
Please
Now,
with
so
the
palpation.
Mhm.
Okay, so you just use your hand in a circular motion or in an up and down pattern motion just to see if there's something in your breasts. Now, as you do it, if there's a lump, as we call it in the technical term, you would feel it. Adeɛ bi ɛba abɛhyɛ hɔ, asɛ ɛyɛ den, and it moves. Then you would know that, okay, there's a change there. Then you note it down. Now, during your menstruation, you can do it, but we don't advise you do it vigorously because at that time, hormones are in play. Then after your menstruation, we advise you do the same check to see if the lump is still there or it's gone.
Okay.
Okay. So we advise you check before your menstruation and during your menstruation and after your menstruation, just to know yourself. But if you are able to build up your baseline, then you know that this is me. Then you can do it monthly to know the differences. So once you have seen the lump, now aside the lumps, you should observe your breast well. Now you would see if there's a dimpling, there's something on your breast that is pulling the skin inside. It shouldn't only be the areola. The areola is the darkened part of our breasts where the nipple protrudes. So you check to see if it's going in, we call it inverted nipple. Or not just the areola. You should also check if any other parts of the skin is dimpling or it's going in. Then it's also a sign for us. I'm not saying if you see that you should start crying, but it should prompt you to go to the hospital for further investigation.
And I want you to elaborate on one breast becoming bigger than the other, because it may not necessarily mean it's breast cancer. There could be other reasons as well. So I would think the moment you get to see one bigger than the other, the best is for you to go to the hospital.
Yes, so we wouldn't really rush it because we have different people. So for people that are pregnant, it may differ. For people that are breastfeeding, it may differ. Maybe they've gotten mastitis. Because if you are breastfeeding and you get mastitis, obviously the one affected will become very big and very hard and swollen. The other one will be perfectly fine. So depending on the category you find yourself, so we are talking about you are not breastfeeding, you are typically fine, and you find this change.
Okay.
You should quickly come. So that's what
Thank you very much. Still on the Gobe show.
So with the signs and symptoms too, you can also check if your skin is peeling. You touch your skin and then you realize that it peels off. You can see a little skin on your thumb as it's peeling.
Is it at the early stage that you find those peeling as well?
Some people, you see, cancer is funny. Some people, they will not see it at the early stage.
Okay.
But for some people, it comes at the early stage, but they ignore. They'll be like, oh, and I always say, then they don't take it serious.
Okay.
And in fact, in Ghana now, by the time the person comes to the hospital, it has progressed. It's not early. Just a few that come at the early stage. Okay, so once you see that And then you can also observe if there are some irritation, you're always having irritation, or there are some sores developing. When we say ekro bi eba, na eko, you should quickly run to your healthcare provider. You don't have to be shy about it. Come, you can request for a female personnel to attend to you regarding your breast.
Okay.
There'll be a chaperone there, someone to stand there as the person is examining you so that you don't feel that something will happen to you. Yes.
All right, thank you. I want to know if, like, detecting it early, is there or are there treatments to get it cured? Is it curable?
Okay, so let me divert a bit from you.
All right.
Before we can go to the treatment, we need to diagnose you.
Okay.
So with the diagnosis, that is when you would come to the hospital. We have different tools. So we have the physical examination, of which you are creating awareness, you are doing the health screening. So when you come, the healthcare, the nurses or the doctors would palpate your breast and do the physical examination to see if these signs and symptoms that we saw it's present. Now, if it's present, then we use the diagnostic tools. What diagnostic tools am I talking about? We have mammograms. So mammograms uses friendly X-rays that are okay for the breast tissues. Then they will take the mammogram. The mammogram will review. The oncologist will interpret. Then would refer you to even go and take a scan. So the mammogram is mostly for 40 years and above. If you are under 40, we don't request the mammogram for you. You just do the scan. But even if you do the mammogram, you still be referred to do the scan to give us a good confirmatory test. Then we can say you have it. Because it's not easy to tell someone that we've diagnosed you of breast cancer. Yes, so we do the mammogram and then the scan. It's a normal scan as we do when you're pregnant. We have that one too for the breast. So the examination, physical examination, mammogram, and then the scan. If we think that we still need to find it more, then we can go for the MRI. But if not, we do this three first. Now, having been diagnosed after the confirmatory labs and then the scans and the imagings, then the treatment regimen. So globally down, what we usually do is, it depends on the stage at which your cancer has reached. So we have stages. We have stage 0, 1, 2, 3, 4. So depending on where it has gotten to, that will tell the oncologist what method to use. Now, you have gotten it. We need to treat you. We have chemotherapy, the use of drugs. It's not anything. People hear it, oh, hey, oh yeah, chemo, yeah. No, it's just like an infusion. Then they will set line and then they will give it to you. It's not anything difficult. Now we have radiotherapy. They use rays to get to the tissues.
Which of them gets your hair, Sakura?
So, I had wanted to speak about it at the complications aspect.
Hold on for me. Once again, we are on Khariz podcast, showing on Khariz TV. This is the Gobe Show. This is October. We are in the pink month where we create awareness for breast cancer. So we are here today. Some people will be wondering why Osofo is here. Osofo is here because he had a close experience, and even not to remind you of what, yeah, he even lost his wife to breast cancer. So that's why he's here. Osofo, when Mamines was telling us the symptoms and you were nodding your head, please, can you tell us some of the things you also saw with your wife when she had breast cancer? At what time did you get to see it? Like, get to know she has breast cancer?
Thank you. Right. So she spoke about the peeling of the the skin on the breast,
Okay.
and then the denting on the around the nipple area.
Okay.
And beyond that, also we discovered a lump.
How did you discover it?
I think there was a time she spoke about a lump in the left breast. So, as inquisitive as I am, I started reading about it and I discovered how to do the examination, which I did. We felt the lump. It was not just one, it was two.
Multiple lump.
Yes, it was two.
Okay.
And then I think in progression, we saw that, like little sores.
Yeah.
And it comes and then it will heal, it will come and then it will heal.
Oh, so
Yeah.
all the symptoms.
All the symptoms she spoke about
He
are
experienced
that we
but it's
we obs-
scary, right?
yes, it is very scary. It is discouraging. You know, as humans, anytime you observe something foreign about your body, it discomforts you. So you wonder, what is this pimple on my skin? Especially if it is a boil. What's this happening? I've observed sudden discoloration of my face. What is happening? So she was discomforted, and I, the husband, also was very uncomfortable about it because you just have to know what is happening. Then we decided to proceed to go and do the medical examinations.
All right.
So we went to I don't want to mention it.
Yeah, you don't have.
We went to a place in Aspintex where they did a mammogram. They discovered the size of the lump and all of that. Then from there I think we did one at Tema. That was when we had to do the intensive test, or the lab test and all of that. Then the diagnosis came out that it was breast cancer.
And that I'm sure that they would have been a sad for you.
For me, I had to be strong because psychologically you have to be strong for the person who is going through that, so that they will also have the courage to face it and deal with it. So that particular day, I was calm. I was calm. So the next day, I had to place phone calls to some, colleague doctors and ask Charlie this, that, and that. Then I chanced on one mate of mine who is now an oncologist. So I called him and I said, Master, I'm seeing this and that. These are the diagnoses. Sent him pictures of the results and all of that. It took him about 4 days to get back to me. So the longer it took, my BP went high. I became anxious.
Sure.
So I'm sure, because the medical practice, they will tell you that if you have to break a news to a patient, you have to psychologically prepare them. So I knew that window, he was finding the right words and the tone to communicate that to me. Then finally, it came out that, this is what you are going to do.
It is. I'm sure the experience is not nice. We wouldn't want to have our partners, our friends, and everybody going through that. So like Mrs. ACN was saying, I think most of the time, she said it all. Most of the time, we refuse to even go to the hospital. I don't know at what point we would want to go. We talking about the field of the Christendom. Because we claim to believe in the power of healing, most of the time, when we even get to see it, we refuse to go to the hospital. The first place we will go is to go and tell our pastors we are experiencing this. The pastor can only pray with you.
Yeah.
From my perspective, I would think that the moment you start seeing those signs and symptoms, and I don't think we should even wait that long to see signs and symptoms before we do a once in a while check. I think the fact that Auntie Les has already told us that as a woman, you stand a chance of getting breast cancer at any stage. It means every time you should have it at the back of your mind to check and make sure you will be okay or you are safe. And then if there is I'm coming to where the early detention area, and then how best you can help yourself. And then the myths behind it, some conception, some informations we get, some of the
Misconception.
yeah,
There's
the misconceptions,
skepticism behind.
yes, why we don't want to go to the hospitals. So I think Osofu would do that for us.
I am a faith healer, right? I believe in the healing power of God. I've seen a lot of people being healed at my feet. But I strongly believe that the medical practice is backed by God. I strongly believe that.
Yeah.
Because if we believe that all wisdom comes from God, and the wisdom of the medical doctor also comes from God.
Yeah.
Even in the days of old, when technology has not been discovered like this, there were people who were practicing medicine in the days of old.
Yeah, I'm sure.
God told them what to use, the herbs to use in order to heal themselves. So God believes in the medical practice, right? And so if somebody finds himself in that situation, I believe that the best thing you can do beyond talking to your pastor, beyond seeking prayer, is to go to the medical professionals so that by their knowledge and their skills and the right tools at their disposal, they can properly help you to discover what exactly the problem is. Discovering what the problem is step one in solving the problem.
Yeah.
So I strongly believe that if you, in my case, for instance, when we discovered that, the first thing I said was, let's go to the hospital whilst we pray.
Mm.
I am sure that if we didn't go to the hospital, it could have been worse.
Thank you.
Though whatever happened, happened.
Yeah.
But it saved us a lot of stress by going to the hospital. Because when we went and the mammogram was done, then the prognosis came out, the diagnosis came out. Now we knew what we were faced with.
Mhm.
And then we could use the right strategies to handle them. But I have seen people who were not supposed to die,
Mm. Mm.
die
Yeah.
because in quotes, they don't want to go to the hospital.
I'm sure Auntie Ness will even tell us more, sorry, because she is in the health field, and like she even said, most of the time, by the time they get to the hospital, are in the second, third
Yes.
to fourth stages.
There are people who have come to me with illnesses, right? And whilst praying for them, I feel the need for them to go to the hospital. Check what is wrong. Let me know. Now, you checking what is wrong does not mean that you don't have faith. It's as simple as that.
Thank you very much on that.
Faith without wisdom is foolishness.
Yeah.
You have faith in God, but you must apply wisdom in the expression of your faith. So you have faith that God can heal you. There is a wisdom that says that knowledge has been given to a certain professional to help identify what is wrong with you. A young lady came to me recently with an issue. Then when she came and I was looking at her, I discovered that she has varicose vein all over. I said, okay, there's a problem. So go to the hospital. I gave her a number to call. She went to the hospital. And when she went, they did all the tests. The diagnosis came out. And they put her on a treatment, right? After a few days, she called and said she's feeling much better. I said, this is what wisdom is supposed to do for you. So, to anyone watching us,
Mm-hmm.
if you find yourself in any of these situations, it doesn't mean God has neglected you. God has not neglected you. As a matter of fact, He loves you so much. That is why He has given opportunity for medical professionals to be there at your disposal. So, you find anything like that, go and get yourself checked. Seek help from a medical professionals. And to my colleagues who are preachers like myself, and I'm going to step on a lot of toes, but it's fine. Let's teach our people to understand that it is not evil to go to the hospital. It is not against God to go to the hospital. As a matter of fact, when you go to hospital, you are applying the wisdom of God. So let's teach our people to believe in the medical practice as they also believe in the healing power of God.
Okay. Thank you. Auntie Ness. In fact, she's the founder of Gem Life. Gem Life Advocacy Foundation. They do breast cancer screenings and even health screenings. And then I'm sure she has had experiences with people with cancer. I held on when you were about telling us about the preventive and then the healing aspect, how we can get healed in the hospitals as well. I would like you to take it from there. And then give us an experience, a way you experience the patient and how it is, especially when it comes to cutting off the breast. I'm much more interested in it because this thing, I'm taking it very personal. I've seen friends and few people go through it. It's emotional. It's painful. The experiences are not nice. And I think most of them went late. If they had gone earlier, like our pastor is saying, maybe a lot could have been done. And then they may lose their breast, but have life and continue the journey of life. So when God calls them home, I'm not saying when the person passes on, God has not called them home, but sometimes we shouldn't be ignorant. We should take steps. So, Auntie Mimi, please.
Okay, so as I stated earlier, the treatment regimens, doing the chemo, the radio. Now, the radical one that we do is a surgery. So with the surgery, we have two. We have the lumpectomy. So that one takes the lump out. So with that one, they will check the size, the stage at which it has gotten to. If we take the lump out, what's the prognosis? How is it going to help? Now, we will take it out. Then we realize that no, the cells are growing. When we take it out, it doesn't mean that's all. We take it out, they'll go back to do chemo and other things. But some people, once the lump is off, they don't care. Then a relapse comes in. Or probably yours, we go straight and take the whole breast off. That is what we call the mastectomy. So it's either we take one, the affected side. And some people would opt in the outside world, they will opt that once you're taking this one on, take this one off as well. So that I know I am free forever for some people. But in Ghana here, even to take the one off, you need to counsel the patient a lot before the person will accept that this is what has befallen me. So I'm coming in for the mastectomy.
In that area, is it the ignorance or losing a breast?
So it's not only about the ignorance aspect. Even with health personnel that have gone through this, that have gotten cancers, it is not easy as a human being to go through this. The mere fact that you are going to lose one aspect of yours is a big deal. You know, with the outside world, once they take the whole breast tissue off, then they will come in with the plastic surgery. Or they will give you other things to shape your boobs. But with Ghana, once we take it off, that's it.
You are flat.
You are even shy to do other
You
things.
become flat.
Exactly. So we are trying to incorporate this aspect of retaking the breast off. Then we come in with the plastic surgery so that you also feel whole again.
But it's expensive.
It's expensive, but we have donors going around helping people to get it. I mean, if you're a woman, you know how we do it. Even if your breast is small, you can heap it, you can pack the towel there, and no one will know that you are using an artificial something. So that is that aspect. Now, the preventive way. So this lies on everybody, like what we are doing here, Khariz TV, right?
Yeah.
Okay, shout outs to you. You've done so well. This is part of the awareness creation. I think we should do better. Now, it's even for the past years, it wasn't so.
The statistics.
Yes.
How
For the
is it
past
now?
for the past year, last year, we're looking at over 4,000
Women
women
in Ghana.
globally.
Okay.
Okay. In Ghana, the statistics, we may have like let's say two, but 2,000. But then
2,000
yes,
women.
that is those that have gone round and is on data. So imagine the one that is not on data. It's just like when COVID came. We're reporting cases that have gone to the hospital. But those that were in their homes, taking neem tree and the rest, were not recorded.
And this breast cancer, some people are home taking sobolo.
Yes. So it's a challenge. When you tell them to take their drugs, yes, they believe
Please,
in
my
God.
ladies, the moment you start experiencing all the symptoms that Auntie Ness and even Osofo mentioned, please, it's our health. Nobody is responsible for it for us. Your breast matters, like mine, the way I'm sitting here with it dangling. Please, go check. Go to the hospital. The first place you should go, I think, is to the hospital before you even get to your pastor. It's about faith. The pastor mentioned faith. It means anything can happen. It depends on your faith. Let's go. We are creating this awareness. This is Gobe Show on Khariz podcast, showing on Khariz TV. Kindly go and take your checks. Going through that experience with your wife, I'm sure it's hell. You wouldn't wait any member to go through.
Very, very, very devastating.
Yeah.
Very.
It's because if you have to be in Kolebu for 4 whole months, yo, guys, this is Gobe Show once again. And we are on Khariz podcast, showing on Khariz TV. This is Pink Month, October, and we are creating breast cancer awareness. And so, Auntie Ness,
Yes.
please, the mammogram, no? Is it mammogram?
Yeah, mammogram.
That one. There is these misconceptions about them. And that it rather gives you other health issues. I would want you and Osofo, but you first, to clarify that. And then I would like to hear Osofo's experience with the mammogram. How, like, give us a very vivid description about the whole thing. And let's do the encouragement. Let's just go.
Okay. So with a mammogram is a device that uses x-rays. But these x-rays are friendly to the breast. It has minimal invasiveness. So it doesn't give you any health condition. You just go, you give your breast to the person who will take it. It's a machine. You place your breast on the machine.
Okay.
Then it will flatten it.
Hey.
Yes. Yes. It will flatten it
Hey.
for it to be able to view through well and take the picture that some people will say it's painful. It's not painful, but it's uncomfortable.
Okay.
It's not painful.
Okay.
But it is uncomfortable. I mean, it's not when you are having a good time. So you would have that, especially when it's a male taking it for you. If it's a female, you feel a bit relaxed. Okay. But if it's a male, but you just need to relax because it's solely expertise, nothing more. Okay. It wouldn't give you any other health condition. It's just going to help you so that you can get diagnosed. So we encourage everyone, if you are above 40, now October month, people are reducing their prices. Just go and take the opportunity and go checked.
All right. So Osofo, please. Were you there when the mammogram was done on
Yes, I was present. I was present from day one to the last day.
Wow.
Um, so I can boldly say that there's no mysticism about it. There's no qualms about it.
Thank you.
Go through it and be safe. You know, there is this misconception about the UV light
Okay.
that it destroys your cells and all of that. And that is not true. That is not, the physics behind that light is such that it gives there's a term they give to it. It gives the equipment the space to identify the lamp that is there. That's all. It's just like you go for a normal X-ray, you stand before the X-ray machine, and then it throws a UV light that will take the picture that needs to be taken, and that's all. The only discomfort you feel is that maybe somebody is touching your breast and all of that. But you have to think about you living.
Will somebody be holding their breast before the mammogram will be done?
No. It will be so. There are times when, with my experience, I was one who even held the breast and put it on the machine.
Okay.
That is it. It was a male, and she wasn't comfortable, so I had to do that. You just put it on a machine like an X-ray from the bottle. It'll just take, and that's all. You have to get tested. It's very important. Just as you would trust the nurse to use a syringe to take a blood sample, trust them to also do the same for you, and then you'll be fine. You know, hmm, we have to do a lot of talking.
Mm-hmm.
And
I'll be coming there.
and that's a lot of
I'm
because it is not what we think it is.
Also, I'm coming there. Just hold on for me a little. I want to ask Auntie Ness once again. Is it curable at every stage from 0 to 4? Is it curable at every stage?
Okay. So I would say it's not curable
At every
at
stage.
every stage.
Thank you.
Once is there, treatment must start. And the treatment is going to prolong your life. It's the prolongation of life that we are looking at. But it is not totally curable. Then we manage the symptoms. That's the chemo and the radio will give you. Because some people, when they take the chemotherapy and the radiotherapy, you realize that there's nausea and vomiting. Some people will either get diarrhea or constipation.
Nakuran.
And then the hair loss comes in. Okay, because once your immune system is down, the cells that God has given you is down because of the chemotherapy and the radiotherapy. They are so strong that they kill the normal cells. That is why now they would add drugs that will let your immune system be boosted. It's also a therapy on its own. Then they'll give you some hormonal therapy.
Okay.
As well, because they are very careful. The estrogen and the progesterone, they play funny. So now we do direct therapy on the hormones where you really need it. Okay, but with some people, some survivors, after the therapy, they've gone through all these therapy and they are doing well. You realize that some form of hair starts coming. Okay, not for everyone though. So now, even now, it's a fashion. We all go and then we have our hair cut. Okay, when we need to go somewhere, we just take our wigs and off we go. So this year's theme is talking about don't face it alone and stop the stigma. So we are encouraging everybody to stop the stigma so that the people do not face it alone. They will come out and be bold, go for their sessions, and even speak to other people of ways of detecting it very early. So the stigma is what is killing the people not to come early to read the health practitioner.
Okay. In creating the awareness from the angle at which we stand right now, especially in the Christendom, there is a lot of this misconception. At the same time, some of our leaders are also not helping. Like Osofu will tell you, he said he will encourage you to go to the hospital after even praying with you. Some people won't. Let's go to the hospitals. Go and take your checks. Please. The damage it's doing to us, it's too much. Even when you get to the stage where they do mastectomy, no, when they do that for you, there are other ways you can still show that you have boobs. It's not a crime. Auntie Ness said the prolonging of their life. That is what we are working at. That is why today, Khariz podcast, showing on Khariz TV, has taken it upon itself to create this awareness for us. Please, let's go and do the checks. Asafu once again will share his. I'm going to give him all this time. I'm going to give him all this time to share some of the painful moments so that we will all come to terms that it's not easy. Financially, emotionally, physically, spiritually, it's not easy dealing with breast cancer. Even the name cancer, it makes you like get bomb all over your body. The moment you even hear, I'm sure Osofu will tell us the first experience how it. I would like to hear it. Please tell us something. Not only the first, from the beginning, but snap your mind.
I think when we first had the diagnosis told to us that it was cancer, and like I said earlier, it disturbed her, but I had to be strong for it. But I can tell you that day when we went home, I couldn't sleep. I was up the whole night, doing a lot of thinking. I was reading, I was researching, I was asking questions, I was calling all the doctor friends I know, and I was going back to my notes. What is it? What's happening? How can I, help her? It was very daunting emotionally because suddenly you are saddled with how do you deal with your personal struggles, personal emotional struggles, and how do you support her to go through this process? Emotional side, financially. Financially, it was a mess. And being a pastor, you couldn't talk to just anyone about it. No, I said before we started, I said that for me, my case was strange because number one, there was one section of my family that were not in support of the marriage. So who do you tell? Right. Number two, you're a young preacher. You are upcoming. This is what is happening to you. Who do you tell? Number three, I was surrounded by very terrible colleagues in ministry. Even before this situation.
In what? Ministry?
In ministry.
Like church?
Like pastors.
Oh.
Before this situation, they give you the impression and even act in ways that suggest that they don't want you to do well. So how do you even tell them that stand with me in prayer?
Yeah.
For that experience I went through, number one, I could have lost my mind, which I did. I'll share that story. I could have died, which I nearly attempted. It could have destroyed my church.
If you had died, what would she have done?
Yeah, that is it. You see? And so, so we went through it. We started with the chemo. From that time, I took it upon myself that, look, I'm going to intercede for people in the areas of their health. It was no joke because we were doing Herceptin. And Herceptin at that time in 2020 was no, Herceptin started in 2017.
Okay. Hey.
Yes. Herceptin started in 2017. So we did Herceptin almost throughout the whole of 2017. Right. And at that time, every session was about 1,600.
How much?
1,600.
And what is that?
And we had to do about close about 10 sessions.
What was that for?
It was for the chemo.
Okay.
So they give you the lines. It's like taking normal drip.
Oh, okay.
It's like taking normal drip. But then it goes to attack the cancer cells. But because he had to go through the bloodstreams, it affects other cells also. So you see that the tongue got dark, right? And then the fingers also got darker.
This is not a good experience. Like even sharing it.
Yes. But people have to know. You know, the thing is that we have to be able to demystify it.
Yeah.
There are others who have gone through it and they have survived. Right?
Yeah.
Others couldn't survive. We can't say that because others couldn't survive, so others can't survive.
Yeah.
We have to be able to take away the fear factor from it so that people can go through. In as much as it is unpleasant, you have to live long.
Yeah.
You have to fulfill your assignment on earth. So you have to go through. So coming back to it. So loss of hair. I think she even lost the eyebrow. Yeah. She lost hair everywhere there is hair.
I believe she had sores here because it's very difficult to get their veins as well. Yeah.
So the hair was totally gone. I mean, one day I was going to, she had to take her bath. So I was doing almost everything for her. And then I put water in the hair or everything.
Yeah.
Yeah, everything.
Oh, it's so scary.
Everything went off. I broke down, but you have to look at the person. So I just had to put myself together. She was crying. I have to, it got to a point I couldn't hold it. I broke down with her. And one very unpleasant experience in between that is, when you are doing the chemo, your immune system is low. It can go up to 0, even up to the negatives. So you can easily get an infection.
Yeah.
So I don't know what happened. She had an infection and she had diarrhea. She was running from 12 a.m. to 4 a.m.
Huh?
There was no car. All the people I was calling were not answering the calls.
They were asleep.
So I had to put her at my back. Yes, I had to carry her at my back and walk to the main junction.
That's a supportive husband.
Walk to the main
Well, God bless
junction.
you.
Take a car, take her to Kolebo, that dawn. And then she was stabilized. We came back home. But at some point, she got pregnant, right? Right after the chemo and the radio, she was fine. She was cleared. But she
so full. Oh, so full.
for doable. She was fine. She was cleared. I mean, she was cleared.
After the chemo and
After the chemo and the radio, she was fine. She was cleared. All the other tests came out positive. We were fine.
You went for honeymoon.
And then what husband and wife?
To the glory of God.
And
We thank God. At least we were celebrating.
it went on. Then later, we discovered that the issue has metastasized. How is that? So all the questions that I have to ask all those questions. Finally, the explanation that came was that there was a possibility that it could metastasize, even when you've been cleared, right? So for me, I was okay in my being that this is medicine. This is human anatomy. Anything can happen. So now what do we do? So we had to go through another cycle of pain. She couldn't breathe properly because after that we did a CT scan. And then when the scan results came, because of my little knowledge in that area, I just saw the thing. I was like, God.
At this time.
That's okay. Because when I saw the CT scan results, then I knew what we were dealing with. I knew that where we've gotten to now, it is life and death. Because 96% of the liver, of the lungs, is gone.
Wow.
96% was gone.
Obviously, there was no churning back.
Both lungs, the lungs, everything was gone. kidney slowed. The kidney was very slow.
Yeah.
Liver, the liver partially gone. I mean, I was holding the thing in my hands like that. And I didn't let her see it. I was just shake it because I knew that and my thinking was, young pastor, people don't like you already. How are you going to tell this story?
Yeah.
Coolest people who understand this thing
Who will empathize with?
with you.
What's it?
Children.
Mm-hmm.
What do I do?
And she was still pregnant then.
Yes, with the toys.
Oh, so you see, you didn't shoot small.
My in-laws. And you know, Africa, when your husband dies, you killed her. When your wife dies,
You killed her.
So all of that was running through my head. I had to put myself together. So we went to the doctor. When the doctor saw my face, she asked in Ewe, what you saw on the sheet, do you understand? I said, yes, I understand. I'm bleeding her. Have you told her? I said, her state now, we can't tell her.
No.
So then I told the doctors, you know what? What can we do to save her? What, desperate. What can we do? You know what? I already have 4 kids. Take these ones off. I want my wife.
So for that is abortion.
So what? Abortion, so what?
So
Call it what?
abortion, when is detrimental to the health of the mother, is no SM. Yeah, that's
Which part?
No, we will come there. We will come there. So back and forth, and I got desperate.
Mm-hmm.
I needed answers. And then you will go to the doctors and they are not telling you anything. And you see the woman is suffering. You need what can be done. What can be done. So finally, after I had become the favorite of every daughter, because I was knocking on every door. So that they will be in meetings and I'll badge in.
wow.
I need answers.
Yeah.
And thankfully, they didn't see me as a nuisance. They saw me as somebody who needed
The
answers.
field.
I mean, all the young doctors, the specialists, the resident oncologists, he was always on his feet. I don't know what happened. Maybe it was fever or something. He was always on his feet. Even when he goes home, he will call. Are you okay? Have you eaten? Have you seen her? Have you go and talk to this doctor? Go here, do that, do that. I made a lot of friends in college. Then finally they sat me down and then they told me that she will not survive. But they have to. Then they were administering Merinom
Okay. For the infection.
for the infection. And that one too was another cycle on its own. Because you are buying Merinom and there was one other one for the babies every 2 days. Huge sums of money. And we were running tests every day. After the test, it was an immediate. Every day you are doing full blood
And
count.
it was cost intensive.
Very. That is why we are saying that,
Happiness.
look, to be on the safer side, early detection is best.
Best. I agree with you.
When they did the mastectomy, when they had to do the mastectomy, she says, no. Hey, my husband likes moves, so if you take it off, he'll be in trouble. I said,
I thought she knew you now.
I said, madam, this point, forget about what I like, what I don't like. Let's get you alive.
Yeah.
Let's get you living. And for any husband whose wife is going through that, I will advise that you have to be very supportive.
That word.
The longer they will live is dependent on your support. By God's grace, I don't know where I got the strength from. I was able to stand with her until her last.
Also, when did that start? Because the number of years before she passed on.
2014.
You don't mean it. And she passed on when?
2020.
Wow.
2014. So we started that journey.
That is 6 years.
So I came to zero.
Wow.
You didn't come to zero.
I lost everything. And I'm not saying lost in a negative sense.
Yeah,
And I sit here today and I'm proud of myself.
you did so well.
I'm proud that because in that same period, there were other men who were going through that. They all ran away and left.
Yes. Most men will neglect their wife.
Only the wives, the husbands. I think family was
Really this.
And in my case, and let me say this boldly, we had to get the mother, who is my mother-in-law, to come and help. She will not come if I don't pay her transport.
Wow.
Yeah. And I know this is go out. I want it to go out. So I paid her transport to come. Then when she finally came, anytime she had to go and check on her daughter, I had to create transportation. I had to.
And your only daughter.
Yes, I had to.
Really?
Please, let's go and check. Oh,
I had to.
as we are doing this awareness, please go and check. I want to thank our director for bringing this Pink October to create this awareness. Please go and check, because what Osofo is saying is not funny. It's not a joke. It's not simple. If family can even ask for transport, I think people have even worse experiences than he has. I'm sure, because some people may be left in the hospitals to just whether they survive or die.
Yeah. Some were unattended too.
Because their families won't come. So, Khariz podcast, showing on Khariz TV, is taking this opportunity. We are in Pink October. We have Gem Life Foundation here. She does screening. In fact, I don't know if our director permits me to use this opportunity to talk about Gem Life Advocacy Foundation. They do free screenings, actually. I don't know when, but I'm sure our director will come up with something. We are grateful to Khariz TV for making this Khariz podcast on Pink October for us. Please go and check. It's not funny. What was to even when you don't brush your tongue and you have all this whitey stuff on it, it's not funny. It's not funny. Talk less of having it black.
And just to add up, you see, now it's free. Take advantage, because as Osofo was talking about it, he said he got drained, is financially inclined. I don't think he wants to get where you would have to sell everything to get healed. That's why family is running, because they don't want to get drained. They will neglect you and you would be alone. Please go to the nearest hospital and check. Don't feel shy. It is free.
Some places it's as low as 20 cedis.
Yes.
In fact, to check for breast cancer, if you are paying 20 cedis to check for breast cancer, tell her it's free. This thing is too serious. You see, for Osofo, a whole Osofo got drained. In fact, sold his cars. He was telling us at the background, he sold 2 of his cars. He sold pieces of land in a prime area, in prime areas, just to get his wife back to herself. And unfortunately, so unfortunately, as young as he is losing a wife to cancer. Also, I don't know if I have. No, I should ask. Did you at any point refuse going to do medical stuffs? All in the name of having faith and prayers?
No. The regiment was strict.
You can't miss any.
I can't miss any. At some point, I had to ask for a long leave to make sure that I am there. And there is no medical appointment I didn't go there. We ran every test. We did everything we were told to do. You see, the thing is that the Bible we believe in teaches us spirituality, but more so expects us to draw from the wisdom that is available and apply it to our lives. So you can be the one speaking in tongues, you can be the one doing whatsoever, but principles are principles. When the principles are laid down, go for the principles, because it is the pursuit of those principles that will make you live a fruitful Christian life. So whatever the Bible says you should do, do it.
Sometimes you can't even cast common cold and flu. Listen, sometimes.
There's a thought that came. As long as we are predisposed to some of these things, they are likely to happen. When they happen, let's go to the right sources for help. Let's seek right knowledge. I prayed for a lady who came and then her leg was swollen, right? And according to her, she's been to a lot of prayer centers, and all they do is to pour oil on it and pray. When she came, when I observed her, I said, Madam, you are diabetic.
Is it because you may have this, maybe you have this background of medical?
Not necessarily that. Even if that is the case, I believe that it is so that I can rightly help people.
All right.
Beyond that, I also believe that there are certain things I'm heavy on wisdom. There are certain things we need wisdom for, right? So she came. I said, Madam, you are diabetic. It is not any ancestral spirit. It's not any witchcraft spirit. You are diabetic.
In a way, they'll say, oh, chochirani.
Now, chochirani, no. They've done to pay. I said, you know what?
Because once your leg is swollen, that's what they will
go to the hospital
say.
And whatever the doctor said, let me know. So she went. The next day she called and said it is true.
Because there's water retention in there.
And guess what? She's been living with this for 4 years.
Wow, imagine. Thank you.
You see. So let's get to the point where we make people feel free and easy to live. We make living difficult for people. How do we make living difficult for people? We don't point people to knowledge, having the right knowledge, and applying wisdom. Listen, there are, because we are in the healing ministry, we see a lot. We see a lot of strange things. Now, we've prayed for people who have vomited caries and vomited frogs. Yes.
And you are still standing there.
Oh, where do I go to? Yeah, nothing.
Run for your life.
We prayed for people who have vomited strange things, right? Beyond that, after praying for them and you deal with the spiritual side, there is the physical side that needs to be dealt with.
Yeah.
So go and check. Let's see if there's an infection. Let's see you have this. Let's see if you go to the hospital and you are cleared of that. The Nigerian pastors do it a lot. When they pray for you, when you come, you say you have HIV, and they pray for you. There's the test kit stations. Go and check if truly you are healed or not. If you are not healed, then they advise the next thing to do. In our ministry, when you come and we pray for you, beyond that, we tell you go to the hospital. Some people, all they need is drip.
Yeah.
All they need. Even myself, 2 days ago, I discovered that my body was misbehaving. I prayed for myself. I said, no. This one is beyond prayer. Let me go to the hospital. I went and said my HB was low. My BP was high. What is causing it? I'm stressed. They said, stay here for 7 hours.
You didn't pray.
After prayer, I have to go and be helped.
I want you on that because most of the time we talk about praying about it and then we don't go to the health facilities.
Wait.
We don't.
So my dear young lady, I beg you in the name of God, when you discover any lump in your breast, please go.
You don't even have to wait or suffer.
Don't wait, just go.
Yeah.
Sometimes the lump can be benign. There'll be nothing in it.
Yeah.
And let me backtrack a bit. When we did the mammogram,
Okay.
and they discovered that it was a lump, I think it was 3. So we have to we have to take it out. So we took everything out. Then the doctor said, go and do histopathology.
Okay.
So I took it, went to Standards Authority. We did a histopathology. So when the results came, I opened the envelope. I read it. I'm like,
It's not funny.
this one day, there is no joke.
Mm-hmm.
So I drove straight back to the hospital. It was Nabita. And then I spoke to the doctor, Dr. Kaiko
Okay.
and Dr. Blebo. These two guys, fantastic doctors.
Yeah.
They look at the thing and say, you know what? You are a pastor, right? I said, yes. We have to cut off the breast. I said, do it.
Wow.
I said, do it.
It's supple.
But we have to talk to her. I said, yes, let me do the talk. The two of you, when you talk to her, she will not agree. She listens to me. So that day I had to sit there. So that day I got back home in the morning. I said, let's go to Ada. So we drove. We left the kids in the house with their auntie. We drove to Ada. We spent 4 days in Ada. 4 days of convincing. Explaining to her why
And you made it easy.
why it must be done. If we don't do it, this is what will happen. So showing her videos on YouTube of people who have survived it and all of that. One night she called me and she said she thinks she's ready. So we drove straight from Ada to Nabita. She was admitted the next day. It was done. In my case, I lost her. But not everybody will die immediately. At least you can live for another 10 years. You can live for another 15 years. And for those who are spiritual, let me encourage you. There is this pastor in America, Pastor Rod Passy. His was throat cancer, and he survived.
Yeah.
And he's still preaching. He has been cleared. It's been about 6 years now, and he's still preaching. And he may live for another 10, 15 years.
Or even more.
Yes. And because it is your life, where's my camera? This one. Because it is your life, you must toughen yourself up for whatever will come out of the results. It is your life. Forget about stigmatization. Those who will stigmatize you are the same people who come and eat at your funeral. So please, no matter what comes out of the test, face it. You will go through this and you will come out well.
Yes.
You will come out good. Forget about the name calling. If it happens that your breast has to be cut off, please let them do it so that you can live longer.
And serve.
And serve society. Serve the world. And you'll be amazed that your survival story will encourage someone else. So my dear young lady, it's not over for you. Please, it's not over. I believe in herbal medicine. I also believe in orthodox medicine. But whichever one the doctors prescribe for you, please go for it. Don't leave the medications and go and hide in a prayer camp. Please. Let the medical experts do their part on you. And you will be fine.
Thank you. We are so grateful for this experience you've shared with us. I'm sure it will address a lot of people's challenges. And to those who are battling it, we are with you. We may not be there, but we are with you. We sympathize with you because of the emotional, all the challenges that are attached to it. And we pray, we agree with each other's faith that the faith you are taking to go through the treatment and to be cured, we pray God answers all those prayers for you. And taking the bold step to even go to the hospital to get diagnosed, with the way Auntie Nurse even said it, going through the mammogram, putting your breast on whatever scan or software has experienced it. I don't know how I'm going to even hold my breast and put on that in that pain. I'm sure it will be painful. Because sometimes even going through your menstrual, those hormonal stuffs, when it gets heavy, it's painful. We are with you. May God heal you, but Osofo mentioned that you can't miss one. You have to complete it. And as you have started, may God bring it to a successful end. And to us, the novices, the people who don't have any idea, today on God's show on Khariz podcast, showing on Khariz TV, we are telling you, please go and get yourself scanned, checked, do all the tests. We are in Pink October. Do all the tests that you need to do, the screenings. They are some Anthony said it's free. Gen Life, it's free. Also, please, when are you coming up with the screening? Let us know so that a lot of people will come and get screened. Please, once again, we are grateful. And then I'm still on the way the society, the stigmatization, society and our churches. What are we not doing? Why are we not talking about it in the churches? Why do we have to wait for October when we can do health talks on Women's Day, Men's Day, Youth Day, Children's Day? This cancer thing, it can be in any field. We are not limiting it to only breast cancer though. But because it is Pink October, that's why we are talking about breast cancer. We have also you have a ministry.
Yeah.
What are you doing for the members?
Well, in our ministry, it's a ministry predominantly for young people. You don't have too many old people.
Okay.
But in my small way, there's a session I always have with the young people once a month. That is, take care of yourself. So, what you must eat, what you mustn't eat, or you feel any sensation in your body, what you must do, what you mustn't do. And I think that it has helped because some of them they are bold enough to say, I'm not feeling good, I'm going to the hospital. One thing I'm strongly against is self-medication. I'm strongly against self-medication.
That one.
Yes, if you are not feeling good in your body, go to a healthcare professional. Let a person advise what to do. Thank God for health insurance.
Yeah.
Go.
Yeah, once again, this Gobe show on Khariz podcast, showing on Khariz TV. We would like to observe a minute of silence for our dear sister. She was with us on a show and she's fast. We want to observe a minute of silence for her. All right. Actually, we would like to dedicate this show to her and our pastor's lovely wife who passed on 4 years ago to cancer. Late Mrs. Rosemary Sobojo. May their souls rest in perfect peace. Hey. And this is where the fear of going to the hospital comes in. Some of the negligences of our health personnel. Our sister just drove to the hospital and you didn't hear of her again. Only to hear of her demise. It's such a painful. So most of the time, Auntie Nest, when we come to the hospitals, we have no idea what we are even going to meet or why we are even going there. Maybe we just go like when you start screenings, you see people will come and they don't have any idea what even the lamp is with all these big buffalo or something where yourself you mentioned here. Somebody does not have any idea at all. All she's heard is breast cancer. Please, the men, you are not left out. Oh. Go and check. I even heard sometimes yours is not cancerous. It's just the lump and it can be treated. Please, can you tell us a little about how you guys do the screenings and why the negligence? Why? Like, because it's taking too many lives.
Okay, so you're fusing two things together.
Yeah, two things.
So let me tackle what we do with the screening. Then I'll come to the negligence aspects. So with the screening, if you come to me in the screening room, I'd first take your idea on what you know about the condition. Then I will bridge the gap. Tell you what you said right, what you didn't say right. I'll address all your misconceptions and give you the right information that you need so that you will be able to also educate someone who is sharing that misconception with you.
Yes.
So we bridge the gap. It's not just about you coming to lie down. And then we teach you how you should breast examine yourself.
I think you do that for us.
Okay, then let me do it now.
Okay.
So we will tell you that when you stand in the mirror, naked, so to say, revealing your upper parts so that the mirror can face you. You observe, you put your hands beside you. Then you observe for the size, as I said earlier. Then you look at the color. So it's observation that you are doing. Then once you observe something, you put it down or you write it down. Any way that works for you. Now you put one hand behind your head like this. Then with this hand, you can use the tip of your fingers, okay, to palpate as I'm doing. Now we have the circular motion. With the circular motion, sometimes as you move here, if something is there, it will move to this side. So after you've done your circular motion, now you do the top and down, just to make sure that you don't miss anything as I'm doing the top and down. You do the same for this breasts as well, with one hand at the back like this. One thing that the lay person will miss, that the health personnel will not miss, is we would start from here. Go under your armpit, because many a time that's where the lumps would tend to go and hide, and you wouldn't pick it from there.
Is it painful?
So at initial stages, breast cancer is not painful. At the latter, so we have types of breast cancer. We have the duct breast cancer. That one, it emanates from where the milk is formed. Then we have the lobular one. So we have the lobes of the breast tubes. It can be found there. Now, the one that is painful, that one is very aggressive. Okay, so it's called the inflammation type. So as the name tells, inflammation of the breast tissue. Imagine you having inflammation in any part of your body. It's very painful. So that is where we would employ something that we call analgesics. Analgesics is simply pain medication.
And
Analgesics. No, analgesics is a G.
G.
Analgesics. They are pain medications that we give to lower your pain level, because it's very painful. Okay, so as you do that, you'll be able to know. So that's, you see, I think it wouldn't even take
it's
you
that easy.
It wouldn't take you
A minute.
a minute to do this every day. So me, it's best done under shower, because at that time it's very slippery. So if there's something there, you can easily feel it. Or when you come to the hospital, some special people, they use oil as their tips. Okay, but it's not so when you are doing the general investigation. We have trained personnel, so we all know what we are looking out for. That's why you try to check. Now, on the negligence aspects, If I'm to link it with breast cancer, I'll come to the parts where I'll not link it with the breast cancer. So if I'm to link it with the breast cancer, I'll say that the negligence, it will come in when you've detected it. Now, you have told the client that this is it. This is the treatment regimen that we are going to take. Now, you need to ask the client their strength. Okay. If you don't ask them, because there are so many medications and the type the person can afford. Okay. So if we have paracetamols, we have the foreign ones and the local ones. I really want to get tested because NHI doesn't really cover everything. So you need to consider the person's strength. You don't start with a higher one and the person is stuck in the middle and the person cannot do it.
I think mostly that's what happens.
Yes. And then also making sure that you are doing the right thing. You see, I'm not saving my people though, but we need to be extra careful because we are being bombarded every time with the negligence aspect, especially when it comes to not breast cancer, any other condition, as our dear sisters on. Okay. So going to the hospital, surgery has so many aftermaths. It wouldn't be from the surgery alone. The complications, the adverse effects of drugs that sets in. So the patient needs to be educated on the complications that may arise after the surgery, such as blood clots. When blood clots occur and it affects the lungs, trust me, you can't breathe, you can't do anything. And once you can't breathe, you are going. So you need to tell the patient. So before surgery, we even teach you deep breathing exercises to do. So on your part, you don't teach the clients. It's going to worry you because you are, after all these long hours operating and everything, you're going to lose the person. How would you even feel? And then also with the aspects of reliving instruments in clients. Okay. I think that aspect too, as theater nurses and then as nurses, we should put in our maximum efforts to dot our I's and cross our T's, make sure that all instruments that are used are being counted and all that. And then with the aspect of giving wrong medications as well, because it happens. Osofo was giving me a backdoor info as he went to the hospital and they served him pregnancy medication. Imagine a man being served pregnancy medication. On our part, it's not nice. And I believe all these things are being spoken about. We go for meetings, we go for trainings, and they keep hammering on us. We are trying to put in our best, and we must put in our best. So, my dear friends and colleagues in the noble profession, let's sit up and raise the name of our healthcare in Ghana up. Let's stop the negligence so that people will feel free and come to us rather than traveling outside the country to go and seek healthcare because they know that Ghana, their negligence is high. Let's do our very best.
Some people will even leave scissors in people's stomach.
Yes, gone are the days, gone are the days. But now with the nurses we have here, I trust my people.
Yeah, okay.
Yes.
And so, what is our call for action in creating this awareness? What's helpful? Because I'm much into the Christendom because of the way we ignore things. We behave like we don't care. Always, we would like to wear clothes and look nice when we come to church, but inwardly, we know we are not okay. Even if it's not on cancer, if not on any other, if not on cancer, every other, aspects.
I think with my sister's job she does on advocacy, there should be an avenue where people can talk.
I think in church you can do that.
Yes, there should be an avenue where people can talk. I wanted to say a little about the negligence.
Yeah, please do.
Then I'll add it up.
Please do.
One thing I've observed with human behavior is that the moment an individual has a challenge, it affects everything he or she does. So on the part of the medical professionals, especially the nurses, my observation over the years is that majority of them go through serious psychological difficulties and they are not able to talk about it. And so when they come to the hospital, they vent that particular anger or distress on the patients. At one of the hospitals, can I mention the names? Or, at one of the big hospitals in this country, I accompanied a friend to go see. The mother was rushed there. And then when we got there, the nurse that was supposed to receive us and show us where the patient was, it was as if she was mean, very insulting, very disrespectful. So the group we went with, everybody got angry, but I told them, calm down. I'm sure something is wrong.
Yeah.
So I took my time to observe her body language. And I noticed that no, something is wrong somewhere. So when we were able to get our patient a place to sleep and all of that, I later went to her and she was very nice. Very nice. So I asked her, is there anything you want to talk about? Is something bothering you? The medical superintendent had insulted her 15 minutes before we got there. So some of the negligences we see, I wouldn't want to say that it is an intentional thing. There are a lot of factors that contribute to that. And I believe that if capacity building is done for the health professionals and they are allowed to speak, if a nurse is not being paid well, what do you expect?
Is that an excuse?
It is not an excuse, but these are contributing factors.
Yeah, okay.
I deal with human beings,
Yeah, I know.
and you'll be amazed to hear some of the reasons why people behave the way they do. You'll be amazed to hear it.
It's interesting.
So I think that taking it from there, we'll begin to understand why certain things happen. Number two, I also think that this may sound harsh, but I'm sorry if it sounds harsh. I also think that some of our people who are found in those professions don't have to be there.
I agree.
They don't have to be there.
I agree with you.
You'll be amazed.
It's not an amazing.
Do a head count. You will discover that there are some, there is, I know I've woken up a lot of dinner. There is the passion. There is the calling. And there is a while away of time. Or because I didn't get into this, let me do this. I've met a lot of professionals in various aspects of society. And you can discover that, okay, I wanted to become a medical doctor, but because I couldn't become, let me be a nurse.
At least it's still in the field.
It's still in the field. So you realize that the person has no calling in that particular place. So they are there and everything annoys them. That could also be a contributing factor. However, I also think that the various agencies in charge of these particular health professionals have a lot of work to do. If you ignore the needs of these professionals, not all of them will give their best.
No, they won't.
So, for instance, you go to some of our hospitals and they'll tell you there's no bed. Can you blame the nurse?
No.
You cannot blame the nurse. So, the health services, they have questions to answer. The medical superintendent in the hospital have questions to answer. So, if you don't give the health professionals the tools they need to work, you can't blame them. So, when you take your time and investigate some of these things that happen, right, you realize that it comes from the top to the down. Recently, somebody sued one of our big hospitals because the wife went to give birth and the wife died. So he sued them for negligence. Now, When I read the ruling, amazing. So, Ghana Health Service, negligence on their part. The medical superintendent, negligence on his part. The nurses that handled the woman, negligence on their part. So you realize that something went wrong from the top that affected those who handled the woman. And the ruling was bizarre. When I read the ruling, it was bizarre.
Were they revoked?
The
Their licenses were just
two of them, their licenses were revoked. And then the medical superintendent was asked to proceed on sabbatical leave
wow.
and go for some trainings. But the question I'm asking is that what is the action plan for those that will take over from them? So I don't want to solely blame the nurses and then the doctors. It comes from somewhere. Look at Kolebu. It was the renal unit was shut down.
down.
You can't blame the doctors.
Yeah.
The things they need to work is not.
There.
A friend died in one of the hospitals in Tema because a whole hospital didn't have a nebulizer.
You don't mean that? Nebulizer.
Nebulizer. A whole hospital didn't have a nebulizer
In this era.
in this area, in Greater Accra.
Oh. Sorry. Well, also,
How much is a nebulizer?
Sofo, please. I think if I should allow you on this negligence, people will be hooked. So, like the course of action.
Like I said, we need to be very loud on advocacy.
Yeah,
We need to be very loud
very loud.
on it.
Very, very.
Society in itself has become stuffy. You know, people are not able to open up to talk about what bothers them because those who receive the informations about any challenge at all are not able to handle it well. I had to take myself through some counseling school because along the line I discovered that I'm having a lot of people come to me with their issues and challenges, but I never had the expertise to handle it. And I'm the one they could trust. So what do? Let me go to counseling school. Let me go and receive the right knowledge on how to handle such people.
Okay.
And I'm glad I did
Yeah.
because now when they come to me, I'm able to, sometimes when you ask them questions, they don't give you the right answers. But when you observe their body language is saying something different and their mouth is also saying something different.
Great.
So as a counselor, you should be able to, put the two together and help them. I think we should open up. Society should allow people to open up. Let's allow people to open up. People have a lot of things that they are swallowed. They can't talk about. There should be a platform that somebody can. I tell my people at church, if you call me 1, 2, and I don't answer, it means 2 things. I'm either praying or I'm asleep. But I promise you, when I see your call, I will call back. So this is what I've done. I've done a voicemail. When you call and I don't answer, there's a voicemail that will tell you what I am doing. So you know. But 90% of the time, you are sure that I will call back and I will listen to you. There are times I tell them that I know it is not all the things that you wanted to tell me that you told me. Go home, send me a voice note. And most of the time, the voice note contains more information than what they told you face to face. Let's make it easy for people to talk about. Now, I want to bring my sister in. I want to say this thing. In my trying times, I couldn't talk to anybody about it, not my father, not immediate family. I could only speak to my apostolic father, Apostle Abraham Lamptey, about it because Papa came across us, that one person who will go into the gutters with you. He was there, he was with me every step of the way. Because of that, I could open up to him and tell him, Papa, your daughter has been taken to the theater. These are the things the doctors are saying. I'm losing my mind. What do I do? Sometimes he say, where are you? I say, I'm at the hospital. I'm coming. He would drive from Dodowa and come to me. Sometimes when he comes, he's not even telling me everything will be all right. He will make me laugh throughout. There was a time I was there, and then I was told somebody was looking for me. It was him, 12 a.m.
Wow.
I've come to pick you. Let's drive around town. So we drove around town from 12 a.m. to 6 a.m. Then he dropped me, went to pray for her. He went to change. He was back in the evening.
God bless you.
Let's be available for people.
Oh.
Let's be available for people. And I want to appeal to mothers and fathers.
And friends.
I don't want to talk about friends. I have a different view when it comes to friends.
I know, right?
Mothers and fathers, please, your children should be, you should be the go-to for your children. If your child is not able to talk to you about what is bothering them, you have failed.
Yeah.
Forget that you are paying your school fees and whatever. Make sure that there is a conducive environment for the child to talk to you.
Yo, this is God's show. God over broken emotions on Khariz podcast, showing on Khariz TV. I was going to ask our nurse to tell us about Gem Life Foundation, Advocacy Foundation. Am I right?
Yes, please.
You are going to tell us more about your foundation. In fact, she's the founder.
That's great.
That's a bold step to take, and we applaud you.
Thank you.
I'm so grateful that in this our generation, a youngster like you will take this whole thing on you to screen people for free. Even if they have to pay, I think you are doing a good job. So I want you to tell us about your foundation and then give us contact, because we are in the month of screening. In case people watching us would like to call you to screen. I don't know if you do private ones, maybe for 1 or 2 people. I don't know, but I just want you to tell us about your foundation.
Okay, so Gem Life Advocacy Foundation is an up and coming one by God's grace. So what we basically do is to educate people on various health conditions, not just breast cancer.
Okay.
We do kidney. We do the chronic diseases, diabetes, hypertensive, cystic fibrosis. So name it, any health condition. We try to explain to the lay people, because our mothers, most of the time, they don't go on social media where publicity is there. So we move to your doorstep.
Okay.
And we give that education. And thanks being to God, ever since we came in inception, we partner with most churches.
Okay.
The pastors are so welcoming that they would let you come and educate their members.
All right.
And there you would realize that people have issues. It's just not about prayer, as Osofo said. Most of the pastors are welcoming. They would invite you, you talk to them, and at the counseling session, it's crazy. It's just like you've even opened the hospital. The things you hear, how you need to really counsel them, it's a whole big deal. So what we do is, after talking to you, then we check your basic, we do our basic vitals for you.
Okay.
Your BP, your sugar level. Lately we added the kidney screening when it was in the health of kidney.
Oh, okay.
Yes. So if you come to us, you tell us your issue, we just don't leave you. We direct you to the nearest hospital that you can afford. We don't have specific hospitals that will tell you go here, that you would think that we have partnered with them. No. go to the nearest hospital where we know very well they have the tools and the things to help you bring your immunity level up or help you get rid of that diseases. That's what we do. And we encourage everyone to have a health insurance card. That's the basic thing. So that you don't tell her that you don't have money. For one person, I had to literally hold her hand, help her to go and do health insurance, and take her to the General Hospital, hand her over to a colleague there to take her through the process. So we go as far as that. And then we take the contacts of these people, when especially for those who have BPs and then the diabetics, we'll take your number. Have you gone to the hospital? We will be on you so that we will get that feedback that we want. We just don't screen you and leave you. No. We will go the extra mile and make sure that you are being cared for. Then we also make sure that those in the deprived areas, though it's not easy,
It's not hard.
we reach out in them because I personally have worked in the Volta region and outskirts of the Volta region before, and it's sad. So I know what people are going through. So we try to also spread our tentacles there. Lately, we plan on doing in December, reaching out to those people who are in need, identifying those children that have been neglected in areas, and then benevolent people taking care of them. We want to go and support that worthy cause. So it's not just about health, it's an advocacy. So any other aspects, we are there, making sure that the health of people is a priority. Yes.
And then, Auntie Mimi, please give us your contacts.
Okay.
Gem Life Foundation, in case somebody wants to support, in case somebody wants to call for screening, even though you may be fully booked. I know with this show, if somebody calls you to say that, oh, I watched Khariz TV and I need this help, I'm sure you give a helping hand. So please.
So our doors are open, yes. As she rightly said, even though we are fully booked, when you call us, we'll still find a way to reach out to you. So the number for Gem Life Advocacy is 053 053 0945. I repeat, 053 053 0945 is Gem Life Advocacy Foundation. If you have any donation, you can put it on this number. My personal number is 0246 230 841. 0246 230 841. You can call and book an appointment. Thank you.
Thank you. Still live on Gobe Show. God Over Broken Emotions on Khariz podcast, showing on Khariz TV. I think we've spoken a lot. A lot has been said. But I would like Osofu to tell us his finals on the breast cancer.
Okay. Being diagnosed with breast cancer is not a death sentence. There is hope. You can seek help and you can be helped. Always talk to someone. Find a health professional and talk to them. Ask all the questions that you need to ask so that you can get all the help that you need to get. Please, I repeat, when you discover that you have any lump in your breast, please go and get checked. Don't go to any prayer camp. Please go and get checked. You can believe in God and still believe in the health professionals to help you. Remember, it is not late. You can still get help. God bless.
God bless you, too. Auntie Nurse, give us your final submissions.
So I'll leave you with TLC. In short, touch your breast, feel it, and experience it so that you'll be able to detect the changes. Then the L will stand for look. You are looking, you are observing for any changes. Now the C, care for yourself. Be concerned about the changes that goes on in your life and especially your breast. Thank you.
Thank you. God bless you. On this note, this is Gobe Show. God Over Broken Emotions. I would also want to say that the health sector is there to help. People have been healed through that. Of course, faith works, prophecy works, the healing hands of ministers works. But when worse comes to worse, you need the hospital. Don't wait for it to be worse before you get to the hospital. Don't go drinking sobolo. Don't go drinking anointing oil. Don't go drinking enka. All those mixtures. It won't help. Pawpaw leaves, whatever. They have a way of curing other things. But when it comes to cancers and all these other illnesses, please go to the hospital. Cancer is a serious thing. It's not a joke. It's not easy to deal with. So, like Auntie Les has said, TLC. Self-love also matters. I'm sure if you love yourself enough, this world is a sweet place. So even though it's difficult out here, it's still a sweet place to live. If not, we will all want to die and go to heaven. But if they say you are going to die, you will just be rushing to look for means to survive. Please, it's not easy. Financially, emotionally, people will leave you. Me, if you call me midnight, maybe I'll be sleeping. It's not easy. Get yourself checked. If there is any way you can get yourself checked, please do. Please go to any nearest health facility. I'm sure there are people there who will take you through those processes, check you. And if you have it, you are not going to die. You can survive it. Osofo has said it. You can survive it. It is not a crime to have breast cancer. The same way people have other issues they are battling with. It's not a crime. It's just a health issue. You can get it dealt with. So please, my friends, our lovely viewers, your lives are important to us. We need you alive. As much as we are doing the kingdom work, you need to be alive to do it. No pastor that has cancer will come out and be preaching when he has to go and do chemo, when he has to go and do mammogram, all those other big English. Please, get yourself screened. I'm so much passionate about it because I had a friend who passed on. She was a young lady and she was a nurse. So if a whole nurse can fall down, we common floor members do it. If we don't get screened, it's wahala for us. God bless you. Again, God bless you. God over broken emotions. All this we talked about, it includes all that. Emotions, finances, and all that. God bless you. Amen.